how many years could we still continue to follow up the patient and giving some feedback to them that will be, there is no significant changes in the MRI and you are rather stable. So we really need these tools that will be helpful not only for us, but also for the patient as a definite feedback. And indeed, we have done it in the last years, and this revolutionized our management in the everyday visit of the patient. Patients feel much better to see, have a number, to see that they have a total lesion load, which is like 13.2. Now it's 11.8, and they know that they're getting better. And for us, of course, it is also an additional tool. We will not take all the decisions only based on one parameter, but it will be definitely, it has become already definitely one of the main parameters that are used to take treatment decisions in our patients, to understand who is a good responder, who is not. And that's a win-win situation. It helps us and it helps a lot the patients as well.
So for us, first of all, I echo with what you said. I agree completely. For a very long time now, quantitative MRI analyses have been available only for clinical trials. Not only that, the data was actually being used as a measure of efficacy.
Yeah.
That's a small, tiny fraction of the patients with MS. We need this technology to be available for all patients with MS, just as medication is available for most patients. What icometrix has brought us is at a reasonable cost, we can provide a technological level of observation that previously has only been available with the use of special centers with large dedicated research input in funded clinical trials. Now, every patient can be measured this way, can be assessed, and like you, we are using this data, I think, to make important changes in our day-to-day patient management. We now have actionable data from icometrix analyses that ordinarily we wouldn't have. So we've gone back and looked at lesions that clearly are enlarged on icometrix, and our highly trained neuroradiologists, knowing there's been a change, still can't see it.
Yeah.
Because it may be a fraction of 1% around the rim, but if that's on 9 lesions and the whole volume of the lesion, suddenly there's a very substantive volume of tissue that's gotten worse. So this is very, very important. Like you, treatment decisions are increasingly based upon this data, as well as will be a very, very powerful research tool, in my opinion. Research that can be done even at the non-university level, have a better understanding of the comparative efficacy of medications, and also before a patient is clinically sicker, to learn when a medication isn't working well enough so you can make a change before the patient gets clinically worse.
Absolutely. And as you mentioned, sometimes there's such a big discrepancy between the neuroradiological report and what we see in the icometrix report. And I had few cases. I have now started collecting all the cases, and I have tons of reports showing the same, bottom line, no significant change. And no significant change, sometimes it is more than 20% increase in the lesion load. And then once, when I saw such a big difference, I went back to the neuroradiologist and said, why can you see this? Because, he told me these are the enlarging lesions, and who has the time and the patience to evaluate each one and measure each one of them. That's why I think that the reports that we receive and we pass to the patients are much more accurate than even our own eyes. We are limited, we are tired, neuroradiologists are tired. No one can give a good report of 10, 20 or 25% increase in the lesion load.
Well, I think you're bringing to the surface the fact that there are still problems to be solved. And some of it's human nature, not technology. So we have a similar situation where some of our radiologists don't even comment on the, they just,
Yeah, yeah,
no significant change seen.
yeah.
Now, I'm not here to ostracize them, but I think it's a cultural change
Yeah.
that we have to teach people to realize that this is part of the report. Now, I don't know at Hadassah, but where I am, the patients can see the reports. And they see an icometrix report that talks about a change and a neuroradiologist report that says no change. And then they call me and say, what's going on?
Yeah.
So we have to harmonize.
Maybe sometimes we forget that we have entered the era of precision medicine, and we should go to this direction and not go back to the old eye evaluations. Now we can use this kind of technologies, including which may be defined as types of AI technologies, because when we want to use this kind of technologies as a help, as an additional tool, it will be helpful. They will not replace the neurologist, but they help us a lot in our taking the decisions when we are borderline situations.
No, it expands their ability.
Yeah.
If they'll consider it their tool. Now, I don't want to be unfair, however. I don't know about the situation in Israel, but I will tell you that in the United States, the radiologists are under tremendous time pressure.
Yeah.
Because they're rated by how many cases they do. Their salary is attached to that. So that's very difficult.
Absolutely.
So if they view something as a consumer of time to little benefit, it's hard to get them to, want to do it. But we'll get there.
Yeah, absolutely. I agree. I once went to see what the neuroradiologist is doing, and he had a pack of 20 examinations to finish in less than 1 hour. So then I say, if I was in his position, I would be much worse.